I got involved with WomenHeart, the National Coalition for Women with Heart Disease, around the same time as I opened our Women's Heart Clinic. And it was soon thereafter we started talking about the need for getting women to teach women and be the face of heart disease, and teach other women about prevention, proper diagnosis, proper treatment. So we started this Science and Leadership Symposium for Women with Heart Disease, and I would have never imagined in 2002, leading up to our first symposium, that this would have such an impact on me, personally and professionally. I'm a better doctor because of this. But what I've really found is that women who go through this program are changed for life. There is a transformation from that victim patient to a woman who is feeling like she's gunning for bear and she is ready to go out and take on the world and teach every woman and make it so no one else goes through what she's going through. So for me, that's been incredibly gratifying since we've been doing this now for 8 years. The women have done everything from become amazing educators to appearing on CNN and educating millions to doing research and fundraising and developing education programs themselves. So this whole thing that got started many years ago has spread beyond what I would have ever imagined. Heart disease is the #1 killer of women. Most women don't realize that, and they certainly don't put as much importance or fear or concern as many other diseases such as cancer. So these women, often who don't look like a typical heart patient, can go out and really help all women understand and make changes in their lifestyle and changes in their life and behavior that might prevent them or certainly delay heart disease. So the impact is real. These women save lives. In fact, 45% of our former graduates from this program have said that they have been told that they were directly attributed to saving a life by giving a talk, by talking about the symptoms, and somebody would come back, my sister was having that and I told her to go to the emergency department and she got saved. Or that somebody called and said, I've been having those symptoms, I heard you speak and I got them checked out and now I have a stent and I'm feeling so much better. So we know, just from talking from our graduates, that it works.
This program, the WomenHeart Science and Leadership Symposium in collaboration with Mayo Clinic, is our flagship program. It is a signature program for our organization that without which we would not be the organization that we are today. Really everything in our organization stems from this training that we do of women, heart patients from all around the country who come to the symposium to learn about heart health, to get a crash course in the science and medical aspects, and then to go back to their communities and speak to other women. And literally every other program that we do, which we provide, support services for women, support programs for women, educational programs out in communities, are all based on the women that get trained in this program. It's extremely rewarding, an inspirational experience. We come here every year to this program, staff. I work for this organization, WomenHeart, and what we find is a renewed commitment to the cause, because we hear about both poor care that women have received, great care that women have received, problems that still exist out there about the knowledge or lack thereof about women's cardiovascular disease, and it really just fires us up to continue our work throughout the year to educate more women, to educate physicians, to educate all health professionals about the unique aspects of women's heart disease. We get an incredible boost of energy just from being here and learning from these women.
This is the 8th year of the symposium, and every year we get a little bit better at doing the symposium, and every year we get a little bit better at not only selecting the candidates, but also we are getting women who have a little bit more education and background, so when they come, they're able to get a lot more out of it.